So you've heard that microsclerotherapy is the best treatment for leg spider veins, but you don't know where to start. If you're a healthcare professional interested in starting leg vein treatment by microsclerotherapy, this video is for you. Now, before you even pick up a syringe, successful microsclerotherapy starts with three important considerations: history, examination, and selective referral for specialist scans. I will cover the proper patient selection process for cosmetic vein treatment, and be sure to stick around to the end where I will share with you my pro tip for success. Let's get started. Patient assessment and selection. In this session, we're going to focus on patient assessment and selection for microsclerotherapy. By the end, you will be clear about who you should treat, who you should not treat, and what you need to look for in your initial patient consultation. Let's start with what we're actually trying to achieve with our assessment. Microsclerotherapy is the gold standard treatment for cosmetic leg veins, spider veins, and blue reticular veins. But to get these results, the process of successful microsclerotherapy starts long before you pick up a syringe. It depends on careful selection of suitable patients and being able to identify those who are unsuitable, whether that's because of health issues, vein patterns, or their expectations. If you get the selection right, your clinical results improve and you dramatically reduce the risk of unhappy patients and complications. Get it wrong, you will get unhappy patients, complications, complaints, and you risk your reputation or registration. So who do we actually want to say yes to? For cosmetic microsclerotherapy, our inclusion criteria are deliberately very strict. You don't just treat everyone. We're looking for healthy patients with healthy legs and no symptoms, no significant pigmentation or skin changes suggestive of chronic venous disease, no varicose veins, and no leg or ankle swelling. On top of that, there should be no medical contraindications, and a screening continuous wave Doppler test should be negative for superficial venous reflux. Once you know who to include, the next big safeguard is knowing who to exclude. The list of exclusion criteria is intentionally long, and that's a good thing. You don't need to memorize every item. Think of the exclusions in three broad categories: health-related issues, vein-related issues, and expectation-related issues. Let's look at the key health-related exclusions first. From a health point of view, we are very cautious because this is an elective cosmetic procedure. Absolute exclusions include pregnancy and breastfeeding, significant systemic disease such as serious cardiac, respiratory, renal, hepatic, or malignant disease, severe osteo or rheumatoid arthritis with very poor mobility, acute febrile illness, active systemic anticoagulation, severe allergy, severe lymphedema, thrombophilia, immunodeficiency, or immunosuppression. Other contraindications include recurrent cellulitis and recent or imminent long-haul flights. Then there's a whole list of relative contraindications, such as advanced age with sedentary lifestyle, obesity, arterial disease, mild lymphedema, diabetes, peripheral neuropathy, a past deep vein thrombosis, or expectations that simply cannot be met. Several medications are particularly relevant for microsclerotherapy. Exogenous estrogens and drugs like Tamoxifen increase thrombotic risk, while medications such as Minocycline can predispose to skin pigmentation. Anticoagulants are not in themselves an absolute contraindication, but they do increase bruising. Beyond the diagnosis list, your routine medical history is still your best tool. But Here, you should also have a venous focus. Ask about symptoms of venous disease like aching, throbbing, or ankle swelling, and any previous venous interventions such as surgery, laser, or microsclerotherapy, and be sure to ask how those turned out. These sorts of questions will expose anyone with very high expectations. I find it helpful to ask open-ended questions to catch anything else significant. 2 open-ended questions work very well here. Is there anything else in your medical history that you think I should know? And what has motivated you to seek treatment for your spider veins now? These often uncover crucial information about both safety and expectations. For example, you might discover that this person is expecting the spider veins to be eradicated before a holiday next month. You might also discover that your patient is very adverse to any minor complications and setbacks. Once you've finished with the history, we move on to physical examination. Make sure you examine the patient standing with privacy, good lighting, and that a chaperone is offered. Expose your patient from the groin down to the feet and allow a couple of minutes for veins to fill, and always be aware of the risk of syncope while you focus on the legs. Things you're assessing are skin color, temperature, skin texture, scars or pigmentations, the types of veins present, and you are palpating for varicosities while mapping out which veins bother the patient most and what your treatment plan might be. Standing is only half of the story. We still need to check the circulation and we need to check for edema. Next, with the patient lying on the couch, you check for edema and you palpate the ankle pulses. If you have any concern about arterial supply, consider measuring an ankle brachial pressure index or arranging for this to be done by someone else, and check light touch sensation if there's any potential risk of peripheral neuropathy, as identified by history of diabetes. All this links back to safety, especially around compression therapy and healing if complications do occur. Once you know what you're looking at clinically, the next question is there any underlying reflux? Is there any underlying reason why this patient has medical spider veins rather than simple cosmetic spider veins? Continuous Wave Doppler is a simple but very useful screening test for superficial venous reflux. I'm not going to go into all the details. In summary, you're looking for reflux in the groin, where the great saphenous vein joins the femoral vein, and you're looking for reflux at the back of the knee, where the small saphenous vein joins the popliteal vein. Reflux, as identified by calf squeeze and release, is significant if it lasts more than half a second. And this should tell you that this patient may need a duplex ultrasound scan. Now, you don't need to become a duplex sonographer, but you do need to be confident enough with continuous wave Doppler to decide who needs referral before cosmetic microsclerotherapy. Remember, cosmetic microsclerotherapy is the treatment of leg spider veins in a person who does not have symptoms and who does not have superficial venous reflux. If you've identified superficial venous reflux, then this patient has underlying problems and doesn't have simple cosmetic spider veins. And that leads neatly on to when to involve a vascular specialist. Now, in this slide, you can see that the spider veins are associated with true lumpy varicose veins. This is the sort of person you would refer to a vascular specialist. If you're not a phlebologist yourself, it's wise to have a trusted vascular specialist or phlebology service you can refer to. Patients may present with thread veins but have underlying varicose veins or reflux. If you ignore that and treat cosmetically, you'll get poor results and you may actually make the appearance worse. So for these sorts of patients with varicose veins, duplex imaging and specialist opinion is important when you detect reflux, significant varicose veins, complex skin changes, or when complications arise and you need a second opinion. To bring all this together, let's summarize the core of patient selection. Careful patient selection is the foundation of a profitable and low-stress cosmetic vein practice. It rests on three pillars: a focused medical history, a thorough clinical examination, and a screening continuous wave Doppler assessment to rule out significant reflux where appropriate. If you stick to clear inclusion criteria, if you respect contraindications, and you use your referral pathways, you will not only improve your results, but also protect your reputation and enjoy treating these challenging but rewarding patients. Now, at the beginning, I told you I would share a pro tip. Well, here it is. Be sure to listen carefully. Beware unrealistic expectations. If you don't feel you can meet your patient's expectations, don't treat. Success is not only knowing who to treat, it's also about saying no to certain people. After all, microsclerotherapy is the best treatment available, but it's not perfect, and you cannot offer a perfect result to everyone. If you found this video helpful, please consider giving it a like. It really does help get the word out, and be sure to subscribe. That way you won't miss my next video. Thank you for watching.